Alright, so we're going to rule out the SI joint with a cluster of tests, or rule in, depending on how many of these tests are positive. The first one is the thigh thrust test. So for that test, you're going to have your patient lay supine on their back. And I'm going to be assessing his left SI joint here, so I'm going to have him bring his leg up. I'm going to slide my hand in underneath of his SI joint here to stabilize and hold. And then I'm going to cup my hand around his knee and produce a force that goes into the table. So I'm going to push down into the table with this hand that's on top here. And if he has pain in that region, then that's a positive test for that one. So that was the thigh thrust test. The next one is the Gangslins test. For that one, you're going to have your patient over the edge of the table. The leg that's closest to the edge of the table will hang off the edge. Then with the other leg that's on the table, you're going to have them bring that one up, and you're going to direct the force going up this way with this leg, and I'm going to push down on this leg. So we're going to kind of produce a shearing force at that SI joint by rotating this pelvis, or this ilium forward and this one backwards. So you'll do that, and that's the Gangslins test. Okay, and again, he'll have pain in that SI region if it's positive. Okay, so the next one is the Faber's test, and for that one, you're going to have your patient bring their ankle to their opposite knee, and I'm going to stabilize here at his ASIS, and then push down on his knee here. And once again, if he has pain in the SI region, that's positive. The next one is the iliac gapping test, or the ASIS gapping test. And for that one, you're just going to find his ASIS on either side, and you're going to push down on both of them and kind of down and out to the side. So that's testing the anterior ligaments of the SI joint, if there's a possible sprain in there or SI joint dysfunction. The next one is the iliac compression test, or the ASIS compression test, and your patient is sidelined for this one. Once again, I'm going to find his iliac crest, ASIS area, put my hand right over there, and push down. So I'm trying to push down and compress and put a strain on those posterior ligaments of the SI joint. Once again, he'll have pain here that can be reproducible, and that would be a positive test. The last one that we are going to do, the patient is prone, and it's called the sacral compression test. So you're just going to put your hand, find his PSIS, and go down from there. So you're right on his sacrum, and you're just going to push posterior to anteriorly directed force, and that's just going to shear the sacrum on the ilium. And once again, if he has pain with that, that would be a positive test. And then one more thing to mention is that there are groupings of these tests. You can cluster these tests together. There's one grouping where it looks at the thigh thrust test, Gangslins test on the left leg and the right leg, the ASIS distraction, the ASIS gapping, and the sacral compression test. Let's say you did all 6 of those, and you found that 3 of 6 of those were positive. You can rule in SI joint diagnosis. The other cluster of tests that we use consists of 5 tests instead of 6 this time. They are the ASIS distraction, ASIS compression, thigh thrust, Faber, and the Gangslins test. And if 3 out of 5 of those are positive, then you can also rule in a SI joint dysfunction. So it's really hard to tell with just one of these tests being positive that we can really rule in or rule out an SI joint dysfunction. So that's why it's important that we do these in groups so we can be more sure when we're ruling it in and ruling it out, because these are proven ways that have been shown to do that.